SuperPath patients without question experience rapid recovery. The interesting thing is many of them don't have any reference point to compare it to. So they'll come in at 2, 3, or 4 weeks ambulating unassisted with minimal or no pain, usually back to work and enjoying a fairly normal lifestyle, and they think that this is really sort of par for the course for every hip patient. Of course, we as physicians and surgeons have the benefit of perspective, and so we know that that's not necessarily the case for every patient. So we talk to them a little bit about that, and I think sometimes they're a little surprised to recognize that this isn't really a universal outcome or situation for most patients. But they're generally very pleased with the pace of recovery and the fact that they're able to so quickly get back to a normal lifestyle.
My first patient had multiple back surgeries and had a lot of pain issues in regard to that, and she obviously had a bad hip, so I knew she needed her hip replaced. I thought if anybody could benefit from an approach that would decrease her recovery time, that might be somebody that would be a good option. And she came back 10 days after surgery, and typically you would have expected her to be in her walker and being in a moderate amount of pain, perhaps. And I said, "So how does your hip feel?" And she said, "Well, it only hurts when I run up the stairs." And she came in with a cane, and I thought, okay, this there's something to this.
I have patients that come back and just give me hugs. They are just so happy with their hips. And most people will find that their experience after surgery is very easy, progressive, to the point where they're doing things that I wish they weren't doing, like people at 3 weeks, working a volunteer at some type of activity, up and down ladders. I mean, I hear those stories and it just makes me cringe because they're not ready for that, but they feel like they are. So sometimes when you do something that's so easy to recover from, people will actually do a little bit more than they should.
A lot of people go back to work very early. A lot of people drive at a week or a week and a half. In extreme case, I've had a patient leave the hospital and go straight to his office before he even went home. So there is an early return to work, generally. So in terms of out of work time, it's quite short. Dependence on other people is generally not at all. And returning to activity at a relatively short period of time.
I've done several cases in which a patient has had the other approach on the contralateral side. I've had several that have had the traditional posterior approach, and that's been a night and day difference. I've also had patients that have had an anterior muscle sparing approach on the contralateral side, and they've been very happy with their results with the SuperPath. They've told me that their recovery was a lot quicker with the SuperPath. I've done bilaterals with the SuperPath, and patients have been back to work in 3 weeks, wearing high heels, very happy with the results. This rate of recovery is not really what we see with a traditional hip replacement.
So basically we are looking at 4 aspects of the hip: anterior, posterior, medial, and lateral. And they were so stable that they're not afraid, like other procedures, of dislocating the hip. I think this procedure is far better than any other procedures I've seen in my 30 years career.